Data published by the CDC, the Center for Disease Control, indicates that over 33% of adults in the good old US of A are overweight, while a whopping 42% of citizens in the land of the free, home of the brave, Mickey D's, IHOP, and Uber Eats have a body mass index, or BMI, of over 42%, which lands them in the category of being clinically obese. That means that more than 113 million adults in the US are obese, which is more than 2.5 times the entire population of our friendly neighboring country, Canada. This epidemic of obesity can mostly be attributed to two factors: the overconsumption of high-calorie meals and snacks, especially fast food, and the lack of adequate physical activities. The use of surgery, weight loss supplements, and prescription drugs have long been popular measures taken by this segment of adults in the US, appealing to those literally looking for a magic pill to aid in or fix their weight loss goals. So much so that according to a report from Market Data LLC, the US weight loss market is currently valued at $75 billion. That's billion dollars. So it was to be expected that when news broke that a certain type 2 diabetes drug could also torch calories faster and more efficiently than any other known weight loss drug known to mankind, that the millions of weight loss supplement consumers and dieters would flock to the drug, like the Black Friday shoppers did to stores before the days of online shopping. Made by Danish pharmaceutical company Novo Nordisk, Ozempic was approved by the United States Food and Drug Administration, the FDA, for treatment of type 2 diabetes. The drug has quickly, however, become known as the greatest weight loss drug in history.
Ozempic, it is literally the hottest drug in the country right now.
Ozempic is a brand name for a semaglutide and was approved for the treatment of type 2 diabetes and heart complications in 2017. In its clinical trials, it was discovered that the drug could also serve as a potent weight loss pill. This little secret started to gain momentum after celebrities started touting their off-label use of Ozempic for weight loss. Celebrities like Chelsea Handler, Remy Bader, Elon Musk, and others praised the drug before it took off on the internet. After endorsements from more celebrities and social media influencers started to reach the masses, the idea of using Ozempic off-label became more appealing to an even wider audience. The miracle weight loss drug became so trendy that hashtags like #Ozempic and #Ozempic weight loss were racking up hundreds of millions of views on TikTok and Instagram at the time. But Ozempic is way more potent than its predecessors of weight loss drugs. For contrast, an average weight loss drug will chunk out 7 to 10% of body weight, while Ozempic will chunk out between 15 to 17%. In an effort to preserve the public trust in the Department of Health and Human Services, the FDA approved Wegovy, another semaglutide under a different brand name. Both Wegovy and Ozempic are the same semaglutide. The only noticeable difference between these two drugs is their maximum dose level, even though the maker, Novo Nordisk, claims the two drugs are essentially different. With the introduction of Wegovy to the marketplace, the hope was that those using Ozempic solely for its weight loss benefits instead for its intended purpose would switch over to the new drug, thereby freeing up the constant shortage of the drug for those type 2 diabetes patients who genuinely need and depend on it. But as the old saying goes, it's hard to stop a train when it's rolling.
When type 2 diabetic George Youssef went to his pharmacy to renew his monthly Ozempic prescription, he says the pharmacist said they didn't have enough and wouldn't for months.
So I was just really taken aback. I figured I'd be out for a month or something, but not 5 months.
His doctor has recommended switching medications.
I'll need a ramp up period for the new drug, and I'll have to do blood work to make sure it's not negatively or I don't have side effects from it.
And Youssef is not alone.
The only thing that they had left was 4 pens.
The shortage of Ozempic's 1 milligram injection pen has others considering their options.
They actually order the pens every day, daily, and they only get 4 pens a month. And then that set off red flags for me, and I went, what?
Ozempic's manufacturer says increased worldwide demand is the problem, as the drug makes headlines in other countries as a quick fix to shed a few pounds. The company says supply issues could persist into early next year.
Another factor driving the demand for Ozempic is the insurance element. Many insurance companies don't cover weight loss medications, such as Wegovy, due to reasons such as safety concerns and cost effectiveness. Some insurance companies also consider weight loss loss as a lifestyle rather than a medical condition. Doctors, however, still prescribe Ozempic for weight loss off-label. Many also find ways to cleverly circumvent the process, even if it means putting their job at risk. Another reason driving the demand for Ozempic is the supply problem regarding the pen device used to inject Wegovy. This made Wegovy unappealing to doctors and people willing to give the alternate drug a shot, literally. But Ozempic isn't the first drug whose secondary benefit ended up becoming its most popular benefit. There have been many similar to this over the years, but probably none more popular than the one that was originally synthesized and studied to treat high blood pressure and angina pectoris, a form of cardiovascular disease. Chemists, however, found that while the drug had little effect on angina, it could induce penile erections. Sildenafil was patented in 1996. 2 years later, the drug known as Viagra was approved by the FDA. That being said, it can be argued that no other drug has created buzz like Ozempic since the dawn of social media. Now, bear with us for a moment as we explain exactly how this controversial drug works and what makes it so potent. Ozempic is one of the class of medications known as GLP-1 receptor agonists. GLP-1, also known as glucagon-like peptide 1, is a hormone that naturally signals your brain that you're full after eating, telling it to reduce appetite and food intake. What this does after injection is to stimulate specific receptors in the brain to suppress hunger and food cravings, while also triggering the hypothalamus to increase satiety. This will slow down stomach emptying, giving you a sense of fullness even long after you've had your meal. So a decrease in intake of food is something that naturally occurs in people who take this drug. Ozempic also triggers the pancreas to release more insulin and inhibit the release of glucagon. This will regulate the blood sugar level and prevent it from getting higher. People who use semaglutide can become medically reliant on the drug, as many people who stopped taking the drug gained back double the weight they lost in months. On an episode of Dear Media's Not Skinny, Not Fat podcast, popular TikTok influencer Remy Bader opened up about her battle with binge eating made worse by Ozempic.
You know, if you once later got into the bad binging and went off it, and I saw a doctor and they were like, it's 100% because you went on Ozempic, because it was making me think I wasn't hungry for so long, I lost some weight. I didn't want to be like obsessed with being on it long term, and I was like, I bet the second I go off I'm gonna get starving again. I did, and my binging got so much worse.
New York City-based endocrinologist Dr. Gregory Dodell told the Wall Street Journal that even despite clean eating and regular fitness, patients can expect to gain back weight. He also stated, most likely you're going to end up eating what you were before, and maybe more, because the body has been in something like a starvation mode, and it's trying to catch up. It's not a matter of willpower or self-control. Since Ozempic went viral, it's impossible not to find new side effects of the drug every week on the internet. Hashtags like #Ozempic side effects have racked up millions of views on the internet. The most well-known side effect of Ozempic is its gastrointestinal side effects, causing such issues as diarrhea, constipation, abdominal pain, and nausea. The FDA conducted a trial examining the effects of different semaglutide doses in adults. When adults were assigned to 1 milligram of semaglutide, 30.8% of them complained of gastrointestinal symptoms. The percentage of those who reported gastrointestinal symptoms surged to 74% in a trial where they were assigned 2.4 milligrams of semaglutide. There has been a conclusion that patients are more likely to have gastrointestinal symptoms the first time they take the drug, or when the dose is increased to a new threshold. Another major problem associated with the intake of Ozempic is gastroparesis, also known as stomach paralysis, a condition where stomach muscles don't contract effectively, causing food to remain undigested for long.
The makers of the popular diabetes drug Ozempic and Mounjaro are being sued by a patient who says the drug's warning labels are not strong enough. Both drugs are used off-label for weight loss. A Louisiana woman with diabetes claims drug makers Novo Nordisk and Eli Lilly failed to adequately warn about the risks for serious stomach problems. Her suit claims the drugs caused stomach paralysis and sent her to the emergency room. The warning labels do list abdominal pain and nausea as potential side effects. Neither drug maker had any immediate comment to NBC.
The miracle drug has also been linked to an increased risk of compulsive suicidal thoughts.
When you Google this medication, they talk about a lot of symptoms. They even talk about some extreme ones, like getting really bad pancreatitis or getting really bad gallbladder issues, or everyone's gonna, live differently with it. But for me, it's not worth it. Because these numbers of people who are dealing with the mental health aspects of it are growing, and nobody is really talking about it. And I want to reiterate by saying, mentally, I am a very strong person. I'll have a little generalized anxiety, but honestly, who doesn't in the world? But I've always been a very confident person, and I know if I'm feeling a certain way, I know how to make myself feel better, and I know how to pull myself out of it. But in this past week, I will be honest with you, and I am so truthful when I say that Ozempic almost took my life. And I know that's a big thing to say, but that is my personal experience, and it wasn't influenced by I don't do any recreational substances. I don't drink. I don't take anything else that would affect me in this way at all whatsoever. But I feel like all I'm seeing are these commercials like pushing this drug, and we're already dealing with such a mental health crisis as it is. And I don't know why this isn't being spoken about. Because the way that I have felt in this past, couple months is not a way I have ever felt in my life. And now on this week, being down and finally a lot of that higher dose coming out of my body, I'm feeling better, but it comes out of nowhere. I'll be watching a show, and then the next thing I'm doing is violently throwing up, convinced I'm dying, screaming, full panic attack.
This seems to be making more sense after the European Medicine Agency launched an investigation into Novo Nordisk, the maker of Ozempic, after 150 reports of possible cases of self-injury and suicidal thoughts related to the usage of Ozempic. After all of these occurrences, the FDA included suicide risk on the official label of Wegovy, but didn't do the same with Ozempic. Another minor side effect associated with the use of Ozempic included expelling offensive sulfurous smell when belching, uncontrollable bloating and farting, fatigue, hair loss, and many more. But with the popularity of these type drugs, and to no one's surprise, pharmaceutical companies are zeroing in on diabetes and weight loss drugs as their new era for significant growth and profit, and are in a race to get their fair share of the pie. The maker of Ozempic, Novo Nordisk, has even overthrown the luxury titan LVMH to become the largest company in Europe. Eli Lilly, a US big pharma company, has also been brazenly capitalizing on this opportunity. In 2022, the FDA approved Mounjaro, Eli Lilly's diabetes drug that can also be used to shed pounds of weight. Mounjaro seems to be more potent for losing weight, even more than Ozempic and Wegovy, as it's capable of reducing up to 24% of body weight. Mounjaro is projected to become one of the highest grossing drugs in history, with $50 billion in annual sales. That's 5 times the annual sales of Wegovy and Ozempic combined. As part of Eli Lilly's plan to dominate the weight loss industry, the FDA approved Mounjaro under a different brand name, Zepbound, for weight loss. In closing, we want to state that the purpose of this video is not to spread fear, but to promote informed decision-making for those of you that may be considering these drugs. From Johnson & Johnson's baby powder being carcinogenic, Pfizer's Celebrex causing cardiovascular problems, Merck's Vioxx causing heart attacks, and many more, pharmaceutical companies have a long history of negligence that has caused devastating harm to people. So putting these drugs into your body is not a choice that you should take lightly. Please let us know your thoughts and comment down below if you've ever used Ozempic or any other form of semaglutide or weight loss drug. Thanks for watching, and we'll see you next time.